For today's Pulp Health AI Collaborative Network, we have Dejan Jovanov and Peng from the Illinois Department of Public Health, and they're here to talk to us about their work in applied AI with charting the AI horizon in Illinois public health, policy frameworks and operational tools developed by IDPH. Go ahead, Peng. Thank you.
Thank you, Andrea, for the invitation to present, and all of you for joining today to learn more about the AI framework and the AI use cases that we have in IDPH. And today I will talk about the AI pillars and the AI policy framework we developed, and my colleague Yin will give you a more deep dive in the technology and the tools that we have developed. Next slide. So for the ones that don't know me, I'm Dejan Jovanov. I'm Chief Data and Informatics Officer for Illinois Department of Public Health. Has been with the department around 12 years in different capacity. Yin, can you introduce yourself?
Hi, good afternoon. My name is Yin. I'm the data scientist of Illinois Department of Public Health. My work focuses on the machine learning and AI development. Thank you very much. Give me a chance to introduce the new AI tools.
Thank you. Next slide. So, historically, public health has largely operated in a descriptive model. So, looking backward at what we already happened, our goal is to transition towards a more predictive and proactive model where we can identify risk earlier, respond faster, and make a better data-driven decision. So for doing that, we work to create a solution in four pillars. So the first pillar is continuous surveillance and early risk detection. We are exploring how AI can help identify patterns, anomalies, and emergent threats in a near real time, allowing our epidemiology and response team to act earlier than traditional methods would allow. The second pillar that we are working on is using the chatbots to train our workforce. We have created a training chatbot that you can assign different personas, and we are using it to train our workforce on different case investigation. Another major focus is the digitalization of legacy public health records, like vital records from 1800s. Public health still relies heavily on paper form, faxes, PDFs, and unstructured documents. So we're using AI-assisted document processing and natural language technology to automate extraction and reduce manual data entry workloads. One of the biggest projects in these pillars is digitalizing 30 million of vital records, some of them dating from 1800s. And you can just imagine the structure of these documents. We are also leveraging predictive modeling to better understand emerging public health threats and improve planning and resource allocation. This includes identifying trends earlier and supporting more proactive intervention, like predicting the measles outbreaks, opiate overdose, weather-related cases like heat and cold, and other machine learning models that we are developing right now. Many times, policy and governance is seen as obstacle, but if it's implemented correctly, it can be catalyst. And you have heard me many times saying this in different presentation, but governance is really very important part that enables innovation. Our AI policy ensures that these technology are implemented responsibly with strong protection around privacy, bias mitigation, human oversight, and accountability. Our overall vision is moving public health from reactive reporting to proactive intelligence. Next slide. As I already mentioned, creating the well-balanced AI policy is huge parts of AI enablement. So I will talk you through the main components of our AI policy. I will provide you with the overview of the main components and the governance framework that we built at IDPH. And our goal was not to create a policy that slows innovation down, but rather one that helps staff understand how to use AI responsibly, safely, and confidently. We begin with ethics and equity because they're the foundation of our approach. In public health, AI decision can have a direct impact on communities and vulnerable groups. That's why we put safeguards in place to reduce bias, promote fairness, and make sure that these tools support health equity instead of causing new gaps. A key point in our policy is that AI is support tool, not the final decision maker. So we require human review and oversight, especially for anything that is public facing or has a big impact. AI help us work faster and handle more information, but public health expertise and professional judgment are still essential and cannot be completely replaced by AI. The policy makes it clear that PHI, PAI, and other sensitive information must not be entered into AI platform that haven't been approved. So we wanted to give staff clear guidance on what is allowed, what needs approval, and which environment are safe for AI work. We want to make sure that AI systems are transparent and easy to explain. When we use AI to support decision or create outputs, we need to know where the information comes from, how the systems work, and who is in charge of oversight. Keeping good records and being accountable is key to maintain the trust. Governance and compliance. This policy set up a formal process for governing AI use. We created review and approval steps that include our compliance officer, that's me, a data governance board, and the legal privacy and security team. The goal was to build a system that supports innovation while making sure we stay consistent, following rules, and managing risk. Bias monitoring and risk management. Another key point is that the governance continues after deployment. AI models can change over time or have unexpected results. So our policy includes ongoing monitoring, fairness check, and performance review. Keeping an eye on things is an important part of using AI responsibly. Training and workforce is another main component. So we realized early that the policy by themselves are not enough. Staff needs training and support to understand what AI can and cannot do. That's why we link this work with our wider data literacy and AI training program so employee feels ready to use this technology in a responsible way. Continuous improvement, last but not least, we see continuous improvement as a living framework. So AI technology is changing quickly, so our governance needs to keep up. The policy includes ways to keep improving with regular reviews and updates, so we can adapt as technology, rules, and public health need change. So our whole AI framework is about supporting innovation while protecting privacy, equity, security, and public trust. So finding that balance is really hard, but it's very necessary, and it's a main goal behind the policy. My next slide. So from here, I'm giving you in the hands of Yin that can give you more overview of the technology and the use cases that we have worked in IDPH. Yin, the floor is yours.
Thank you, Dan. So as Dan mentioned, we have developed 3 AI tools, which are used for data searching and analyze, epidemiologist interview and training, and the structured or unstructured documents digitization. All of the AI tools are developed and used on the Snowflake environment, which make sure the data governance and security. And before I start my demo, I would like to clarify all of the patient data used for the demo today are template data, not the real data. So the first tool I would like to introduce today is the data searching and analyze data, which is on the pilot stage. This AI is developed on the Snowflake Cortex AI agent. The Cortex AI agent uses a ground model through the API. Besides using the Snowflake security system, we also set up the role-based access controls and the data masking policies to ensure the stakeholders only access authorized data slices. With this AI, the users can ask the questions with plain English and without knowing any technical skills such as like SQL coding. And currently, we use the CDC overdose data to action OD2A project and the patient demographic request from Lake County to do the pilot test. So here is the user interface of this tool. It's quite similar as many public AI tools like the Gemini, Copilot, or GPT. So you can type your questions in the question box, or you can use this button to ask your questions in voice. Let's start with a couple questions I chose from the OD2A project. So the first question, I asked the AI to provide the percentage of people who died of a drug overdose with evidence of experiencing an overdose within 12 months before the death. In order to answer this question, the AI needs to retrieve the death data with a special death code related to the overdose and the discharge data with the diagnosis code related to the overdose. Then the AI will use the masked patient index table to link those two data sets and compare the discharge date and the death date to determine if the patient experienced an overdose within 12 months before death. So on the bottom of the screen, you can see that the AI generates a task that it needs to complete for the question. As a human user, we can always go to check this task list to make sure that the AI understands your questions correctly. And the cool part of this AI is once it completes the task and generates the result, you can go to check the thinking details to see how the AI analyze your question and try to finish the tasks step by step. And for this project, because the AI need to go to check 3 tables dataset, that's why maybe you feel it's take a while to finish it, but it's much quicker than human, to be honest. So here is the final result. It gives you the total number and the percentage of the special patient. And the next question I would like to ask the AI would be a little complicated. I asked it to provide the number of the reported overdoses that occurred within 12 months before the death and reported it in a aggregate as the median number and interquartile range. at last, I asked it to create a distribution chart. That's why the AI lists the three tasks. At first, it needs to count the overdose discharge visits of each patient. Then it needs to do some statistic analysis to calculate the median and IR value. And at the end, it will go to create the chart for me. In order to finish those three tasks, compared to the first questions, the AI not just only to retrieve and link the death data and discharge data by MPI table. It will also need to use this MPI table to determine how many discharge visits of same patient. Oh, when I talk about the cool feature of this AI that within the thinking details, you are not only could see the whole process step by step, you also could see the SQL queries generated by this AI. So if you are familiar with SQL, you always could go to double check those queries to see if they are correct or not. Or if you are interested in SQL and willing to learn, you can use that part to do some practice. And that's why I said it's so cool. And for the chart, because I didn't put any specific type of chart here, usually the AI would create a bar chart for me. But if you have a special requirement, like you would like to see a trend curve, then you can add that requirement in your question, and the AI will create this special type of chart for you. Okay, so the AI is working on the last task, and it should be done soon. Okay, so the AI will generate a result for us. It's generated a statistic table with the value of the median and IR as we required. And it's also generate a bar chart for me of the distribution. And if you'd like, you can download the table and the bar chart. So the second project is the local request for the patient demographic information. So the local government, like Lake County, may would like to use a patient list with the name and birth date to retrieve the demographic information from the discharge data. So of course you can, as a user, you can always manually type the patient name and birth date in the question box. Or there is an easy way that you just upload this list as an Excel file or CSV file and ask the AI to retrieve the information of all the patients in the file. So the AI will read the file you uploaded. It can identify the values by the title of each column. It will know which value is the name and which value is the birth date. And before it searching for the demographic information, it will compare this patient with the local date to make sure that your database has this patient. If this patient doesn't exist in your database, then it won't retrieve the demographic for you. And after that, it will compare with the MPI table and find demographic information from discharge data, such as sex, race, location, disease, any features in your data usage agreement. So as I said from beginning, this AI can let you only use the natural language instead of some technical language to ask a question. The only requirement is your question should be clear and the request should within your data usage agreement.
So, really cool. I just want to add is that you can actually have a meaningful conversation through this interface with the database. So you can ask the question if that's something that you're not requesting. You can ask additional question to narrow and clean your request. So really, really cool tool that we plan to clear some of the bottlenecks we have with some of our data that are more often requested and we don't have enough stuff to support. Ian?
Okay, so the next tool I will show you is the API interview and the training tool. This tool still uses the cloud model through the API. It will generate the scenario and standardized patient personas with varying difficulty levels. For example, the easy level can be like in a house and only affect the family members. And all the patients and NPCs are friendly and patient, willing to cooperate with the protocol. And the hard level can be an outbreak of a disease, and the patients are scared, nervous, or even angry of the situation. So this system can allow the staff to practice nuanced interviewing techniques and contact tracing protocols within a controlled and a risk-free environment. The user interface have 6 pages: scenario selection, role play chart, session evaluation, result dashboard, session history, and the scenario manager. So the training can use the first 5 pages to do the training, and the trainers can use the last page to create the new scenarios for the training. So we can start from the scenario selection. You can type a disease name here, and the AI will list all the scenarios related to it. So I will just choose an easy one for the beginner. Once you select it, you can go to the role play chart to start the training. And the AI will generate the initial situation of this scenario, including what's happened, where is it, and whom you will talk to. And it's even give you some suggested actions like how you start the conversation, what kind of questions you can ask the patient or the NPC. Because I'm not the expert, so I will just follow the guidance to introduce myself and start a conversation. And once I put my response over there, AI will generate the reactions of the NPC according to my response. It will do something or ask something and show some emotion. For example, here, this NPC is worried. So I will just continue ask the question and explain the situation, and hopefully we can let it calm down. So because the AI will generate the reaction of the NPC according to your response. So even you chose the same scenario and have the same initial situation, the reaction of the NPC would be different if your response is different time by time. So here it's since the NPC is still worried, like raise her hands, ask more questions. So I probably would start to do some investment here, ask some questions to the patient who has been affected by the situation. So the whole scenario is for the beginner. It should be done in 30 minutes. I don't think we have enough time to do it, so I will just stop here and let the AI to evaluate my performance. We have a rubric system saved for the AI, so it will compare my performance with those rubric and determine my score. Yeah, it gave me a score 2 out of 4. And it will give me some details that which part I did good and which part I need to improve. So if you are not satisfied with the AI evaluation, you can always print out the full transcript and discuss with your trainer to see the human, to get the human review and the human opinion. So the session history includes all your trainings you did before, and you can use that to check if you are improved or not. The scenario management would let the trainer to add a new scenario, like what's the situation, what's the disease, the setting, and the learning objectives. So far, we have 5 scenarios saved in our system. So you can add more as you'd like. And you also can adjust the rubric on this session. Right now we have 4 score levels, and you can choose all of them or just choose one of them or add some new. And the trainer can add some new NPCs with the name, description, and personalities. The AI will generate the situation according to the situation and also according to the role personalities to make the different difficulty levels. As I said, with the hard level, the NPC's personality won't be really friendly. And in fact, I tested once before that I chose a role who is impatient and always talks straightly. And I just try to ask a really rude question. And that NPC reacted like he said it loudly and angry that get out of my restaurant. So with these different kind of reactions of roles, you will know that how your performance. The last tool I would like to introduce today is using the document AI to modernization and digitization of the structured and unstructured documents. This AI uses the Arctic TILT model, which is specially engineered for complex document understanding and spatial layout analysis. We can use this AI for different documentations, different format records. So today I will use the birth record as the example to do the demo. That because the birth record is high precision, and in Illinois we have 10 versions of the certificate standards, and each version have a different has a different format. So it's a huge challenge for the AI to automatically identify the form variations based on the year of insurance. In order to improve the model performance, we use the golden records to do the prompt and use the accuracy scoring system to monitor the strict fields in real time, flagging potential anomalies for human review. So this app for birth record named IDEA. The interface is quite simple. It has 3 pages: upload, review, and insight. So you can upload a PDF or image of the birth record to the system. And once you finish the upload and process, you can go to the review to see the extracted values. On the left side, it's your original document. If your document is too huge to view in one side, you always can enlarge it on the whole screen. And on the right side, it's the extracted values. And you always could download the original file and the extracted values as the CSV files. That is for the user interface. So for the engineers, we will use the golden record to do the prompt. That's why the extracted values can be added on the engineer interface. So here is the accuracy matrix we did for the birth record. We did the prompt with 104 golden records, and the average accuracy is higher than 95% after the prompt. This chart shows that which fields on the records give us higher mismatches. So the major reason of the mismatches are caused by the handwriting. The AI is quite efficient to recognize the values from a typo form, but not the handwriting. That's why we plan to continue doing the prompt with more golden records, especially those ones with handwriting. And we are also working on the automate pipelines. After that, the AI can get the document from a shared drive as scheduled and extract and save the values to the database on Snowflake automatically. So that's all of the demo today. Thank you very much for your attention, and please let us know if you have any question.
This is awesome, you all. I knew it was going to be a good presentation, but I'm floored by how much progress you've made. And I've been following it and talking to Dan for a while, and it's just across a really diverse areas of effort too. Hats off. for real. And for the rest of us, this is a good lesson in how you can do it and do it well with good governance and systems that integrate to let you flex in a lot of different directions. Questions? Go ahead, Jim.
Yeah, just a comment. I just wanted to add that we just had a kickoff meeting this week for using Snowflake Cortex AI for an infant mortality use case. It's still very preliminary, but the state health officer gave it 2 thumbs up, and we're looking to move forward with it.
Um, yeah, Jim, we are really happy with the collaboration with Snowflake, to be honest with you. It gave us so much potential, right? And we have worked on this document, especially document AI, with some of their team to create the accuracy level because we are tasked to digitalize in this process 30 millions of records. Some
Yeah,
of them are written on napkin. Like you can imagine that someone written in 1987 something that it's completely unstructured, handwritten, and the accuracy of the model is really amazing. And because we are digitalizing so big amount in the same time, we cannot implement human in the loop for every single record. So we are creating a thresholds through that table that you just show us about the accuracy of different um, records in different decades. So it's really cool to see how this element is working. And that's only one use cases. We have 3 other use cases that we are using the same product for moving from paper to database.
yeah, exactly. And I'd say it's my last comment. That's what's kind of cool for me and the CTO, which is it's kind of the tail wagging the dog. We're getting this analytical decision support capability that then forces you to realize, well, we need a much better job in our data governance and our master data management and drag the process with it. So, good luck. Look forward to collaborating with you.
Yeah, thank you, Jim.
Go ahead, Ronald.
Ronald?
Hi, thank you. This was a great presentation. I said 2 questions. One, I was wondering, I'm just not familiar with Snowflake, so I'm curious what kind of process and burden, if you could go into it a bit, was it to build out the data model in Snowflake for the large language model to interact with? And how did you like proof and test quality for that? I don't know like how many options you have in structuring that. And then I'm wondering, particularly for the epidemiological trainer, how are you doing your continuous quality improvement in that, particularly where it's just so much of like this free interaction with that system? How do you actually then decide, oh, this might be drifting or need further improvement?
So, for more technical, I'll let Yin reply on that. But for the continuous improvement, as Yin show you, there are a process where the AI is grading your interviews, right? And based on those grades, you can also take all the transcript and show it to a real trainer so they can decide if we need to tweak the model, add more prompts in the model to make it more real life response. Because sometimes, you put in a model that the persona is angry old person that doesn't believe in vaccination, and the responses can be very harsh. So you can base on the human review, you can tweak the model to give you better response.
Okay, so for your questions about how to use the Claude model, and or we can say how to use the Cortex AI agent on Snowflake to generate these searching AI. So the whole idea is the Claude model would use to for the AI to understand your question and generate the result with the plain English. And for the SQL query, the Cortex AI use another two functions, which named Cortex Analyze and Cortex Search. So you can input some SQL queries as a prompt and let those two tools know that which datasets should be used for special questions and what kind of SQL query format it should generate to answer the questions. So after the prompt, the model would understand that how to process the query and generate the answer. And on that case, these training materials not submit to the cloud directly. It's stored in Snowflake. That's how we keep the data security.
Yeah, and I want to add about the first use cases. What is really cool is that it's not sitting on one particular database. It's sitting on multiple databases that are connected together with the master patient link. So the AI is intelligent enough to find, link these datasets together and give you the answer from these linked datasets instead of just giving you a unique answer from one single data.
Great, thank you. Um, if no one else has the question, was there a sense of how much time, like staff time, it took to implement the data model?
I would say like 6 months. Are you
Uh,
agreed?
Yeah, so yeah, but have in mind that we are working on multiple cases and we are really, really small team. So
Yeah, so I'm the engineer to develop the tools, but we also have another 1 or 2 persons working on the data pipeline. For example, for the first tool, we need move all the data sets into one environment on Snowflake. Then I can use them to set up and prompt the AI.
that makes sense. Thank you.
I see another question from Sarah in the chat. So the question is it querying across systems? Do you see this replacing the need for enterprise data platform? I will say no, because this is running on our enterprise cloud platform, and it is reducing the needs to create big link tables together in order to run the analysis. So it is something that this AI is doing in the back end, picking up different pieces from different tables and join them together in a result. Sorry, is that answering your question? Okay, see a thumbs up.
And Snowflake kind of operates like an enterprise data platform to some extent. It's not a single AI model, but it's like a system similar to, I guess, Databricks is an equivalent. That's a kind of a market competitor that some of you may be familiar with. So you can actually use the platform itself to deploy all these tools and to do those connections across databases that we're having a bit of a side chat about how to structure your data system so you have flexibility for adding new, plugging in new data systems and not having to be locked into a particular warehouse architecture. It's the data mesh concept. But yeah, that's, it just shows the layers to which you have to like have awareness as you're planning these systems, right? You start thinking about, hey, wouldn't it be cool if, and then you start peeling the onion and realize you have to go all the way down. But I know from hard-won experience how tough it is to plan initiatives like this and to get everyone on board. And I want to highlight a point that Dan made at the beginning, that you need to build policies and systems that support innovation. And everyone has to come at it with that mindset. If you have a control perspective or a territorial perspective, or that's not your role perspective, you're gonna hit bottlenecks that are hard to clear, frankly. And you know, if you try to yes and other people's ideas to get you further, a little bit further every time, you get there. And it's fantastic. Just I think it's a great model for how you can approach some of these things in the constraint driven environments that we're all working in PHAs. And yeah, I think I want to highlight a comment that I put in the chat too, a kind of a lighter weight alternative to the epidemiology investigation agent. Last year in January, one of our earliest recorded sessions was from Spokane Regional Health District. They have a case bot methodology using the free version of ChatGPT, and they created a great, starter pack for how to use it and how to build voice-driven simulations of patient interviews using just prompting, and it's very cool. And having the voice interface gave it a realness that was I remember being really impressed with it at the time, and I still am. So that's there, and I will put the prompt pack that they created with it in the chat when I find it here. But that's an easy adaptation for anybody who wants to try it, and it will save you a lot of time as a manager who needs to train a bunch of foodborne case investigation interns for your summer sessions. Believe me.
Yeah, and unfortunately, all the use cases that we show right now, it's operating in our very close Snowflake environment and are exposed in use by our staff, but we right now we don't plan to have any of these available for external. We'll be using some of these for the local health departments in Illinois, but we don't plan to have them publicly available for now.
I would love to see some of these things packaged up though and decoupled from the internal logic and the governance requirements, and actually more deployable. That's an entirely different animal to make these things scale, but I can see this being pretty valuable across a lot of jurisdictions.
Yeah, like the 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 text to code model is very deployable, right? As we are testing internally on our databases, there's no limitation that can be deployed to any additional database that we have in our Snowflake environment. So I'm really excited to a new project that we have with HFS, where we're gonna link the Medicaid data that we have with our IDPH data, and having this kind of tool on top of that to huge database will be amazing.
Yeah, being able to get insight off your Medicaid data is, that again, that's a huge challenge. I worked with New York City Medicaid data for a long time, and it's a slog. It's a real slog.
Yeah, yeah, yeah.
But I think AI is well positioned to make sense of it. How hard did you find it to replicate analysis results, Yin? Just, did you have challenges kind of calibrating the model to perform correctly over time?
Yeah, I mean, you can see that for the document AI, uh, on some special years like 1930, the accuracy is quite low. So it really depends on that how many forms are handwriting on that special year and how hard to recognize those handwritings. You know, some people would have really hard handwritings for recognize. So in order to improve the AI performance, we must collect enough samples, the golden records to do the prompt. So far, we just use 100 for all the years. And we discussed with Snowflake engineers, and they suggest that we should use at least 100 golden records for each version. And as I said, we have 10 versions so far, and that means we need to do 1,000 golden records at least. And for those golden records, we always need involve the human review. And that would be a lot of time to do this kind of prompt.
Other questions? Great. Well, we're at time. And for those of you going to Boston for CSTE next week, we'll see you on Sunday if you're in the Applied AI workshop. And if not, come by and say hi anyway. I'll be around for a day or two. So thanks, everyone. Thanks, Dan. Thanks, Yin. And we will see you in 2 weeks for Pop Hive. Take care, everyone.
Thank you.
Thank you.
Yeah.